Good morning. Having a proper strategy to know how to study is very important for any professional. Not only for health professionals, but for any student. Sooner or later in any profession we must learn manuals, protocols, therapies, understand them and know how to apply them. It is important to know how to organize and focus the study to get the most out of it, in the shortest time possible. It is about being efficient, especially if you have other occupations and your time is limited. First, we must take care of a series of preconditions: calmness and mental serenity, sleep, hydration, balanced and healthy nutrition, physical activity, organizing our available time well. If you have constant stress, your mood is depressive, or you have unbearable pain, it is difficult to apply any method. First, you should solve your problems, perhaps going to a professional hypnotherapist. To begin to study, we should eat well, in a healthy way, not consume toxics and try to exercise regularly. These are important and necessary factors to achieve our purpose of learning. Learning to relax, eating healthy, exercising and getting organized are important health issues that we will talk about in the next video of this channel. It is important to have the ability to organize ourselves, to draw a plan of action within limits, to set our own goals and making clear a study schedule that we respect. The plan must be real and reasonable, so that we can fulfill it. Our mind will get used to those days in that schedule and we will be able to concentrate easily. Let's address the main point: how to study to learn and be efficient. Basically, we will use 3 steps: reading, pausing and reasoning. Let's see what these steps consist of. We read. We pause as often as we need and according to the difficulty of the studying. Eventually we will learn to value these times according to the acquired experience. We reason. We think about what we have read. It is necessary and advisable to think about the matter read and studied. It is a mistake to read and read again and again without stopping. We must give our mind time to assimilate, understand and organize. How should we orient our way of thinking? We should comment with ourselves about what we have just read, asking ourselves questions. It consists of looking for clues and signs to draw conclusions. We must learn to analyze what we are reading or studying. But what kind of questions should we ask ourselves? Basically 3 questions. What, why and what? What does it mean? We will refer to the meaning. Let's ask ourselves about the meaning of the terms we are studying. If studying these words, hypnotherapy, relapse, pain, we must find out what these words mean. To study, we must understand the meaning of each term we use. Why? We must think about the causes of the statements we read. This is called interrogative elaboration. We read a sentence and then rephrase it in the form of a question, starting with the word why. Clinical hypnosis is therapeutic. Why is clinical hypnosis therapeutic? Because it serves to improve the mental health of patients. By answering, we reinforce the connections in our brain, and it is easier to memorize the statements. In this example, we have offered only one answer, and in a terse way, but it is preferable to answer the question in more detail if there is more knowledge to learn. If we know about the subject studied, it will be a simple and quick mental process. We must study slowly. Our thinking will mark the next step. Let the plasticity of the brain to mark the times, without setting time objectives that will stress us and worsen the learning process. 3rd question, so what? We must think about the effects and consequences of what we are studying. And what are the consequences of clinical hypnosis being therapeutic? We read, pause and think, asking ourselves about the meaning of the terms, the causes and effects, the whys and wherefores, and the consequences of the statements that appear in the study. Let's look at an example. Suppose we start studying systematic desensitization in phobias by means of clinical hypnosis, a usual case in clinical hypnotherapy. In this case, we find only 2 terms. We could stop and start thinking what, why, and what. What do these two words mean? Systematic desensitization. Desensitization is a behavior modification technique, which consists of eliminating anxiety responses to phobic stimuli or situation through progressive or massive exposure to them. Systematics is an area of biology in charge of classifying species. Then we can deduce that systematic desensitization is a method used in clinical hypnosis and psychotherapy within the theoretical clinical paradigm of cognitive behavioral therapies, whose main characteristics is the successive approximation of the subject to situations like those that produce an outdated exacerbation of behaviors. Second question, why does it happen? This is a technique widely used in the treatment of anxiety disorders, especially phobias. It consists in the application of a hierarchy of stressful stimuli through visual images, evocation of the anxious situation with the help of the therapist, exposure in imagination, in virtual reality, or relief of the stressful stimulus. Third question, what happens? The objective is that the relaxation progressively inhibits the anxiety triggered by the imaginated situation, so that the link between the image causing the stress and the anxiety response is broken. In this way, the patient learns a new association. What previously provoked fear is now connected to a state of calm and tranquility, induced by deep muscular relaxation. If we realize just by starting to read and stopping to think about the first two words, we have generated a lot of information that we already had inside us. That prior knowledge, which was more or less unconscious, we bring it to light with the questions. These questions help us to develop the fundamental question to generate mental associations. What does what I am reading remind me of? You can ask yourself this question at the beginning. Many times it will be the only question you will need. From a point of view, it is easier and more structured to do it in the form of 3 steps. The 3 questions we have developed before. With all this, what we have achieved is to build a network of association to help us find knowledge. The more we read and the more we associate biological connections, the easier it will be to understand and the bigger our network will be. That will make us learn more and more easily. We do not have to pause at every moment, but neither do we have to take a speed reading course. In fact, the problem is not learning to read fast, but having the ability to know when to read fast, when to read slow, and when to stop to analyze and assimilate. The idea is to start more superficially at the beginning, get a general idea, a general structure, and then read and analyze more and more in depth. The idea of studying in deeper and deeper circles seems intuitive, but it is based on the Pareto principle. It is the 85/15 principle. 18% of the material to be studied produces 85% of the result you get. This means that you must detect that 15% most important and start the study there. Then, according to the time you have available, you should expand in progressive circles of depth. In this way, the knowledge network will become more and more consistent, broader and more retentive. Synthesis and mental structure. After analysis comes synthesis. We must be clear about the basic ideas from which we must deduce and reconstruct everything else. However, in order to reconstruct, we often need a structure or a path to guide us. What can be used as a guide? The basic questions that are asked in the discipline of hypnosis that we are studying. This will help us to compose a mental matrix, which will guide us in the reconstruction of what we have studied and understood in the previous analysis. The 3 questions of read, pause, and reasoning. This script can be provided by the study material or by the teacher. It will depend on the personal circumstances in which the study takes place. For example, if your study is to be treated with hypnosis, the script we must follow will be etiology, cause of the disease, diagnosis, symptoms and signs, evolution, treatment, and prevention. If you have doubts, ask them in the comments area. On this topic and many others we will talk about in the channel and in the video we will publish. So if you are interested, do not miss our next videos. Thank you very much for your interest.